Hi and welcome viewers of Nursing Academy 101. In this video, we will talk about the latest multiple choice questions for nurses along with the answers and rationale, part 3. But before we start, please don't forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question number 1. What is the appropriate nursing action when managing a client with symptoms of hypoglycemia due to diabetes mellitus? A. Administer a glucagon injection. B. Offer a snack high in protein. C. Provide a glass of milk. D. Encourage deep breathing exercise. The answer is A. Administer a glucagon injection. Administering a glucagon injection is the appropriate nursing action for a client with hypoglycemia. Glucagon helps raise blood glucose level in emergencies when the client can't consume oral carbohydrates. Offering a high-protein snack, providing a glass of milk, or encouraging deep breathing exercises will not rapidly raise blood glucose levels in case of severe hypoglycemia. Question number 2. To prevent aspiration in a client with a nasogastric tube, which intervention should the nurse prioritize? A. Checking tube placement before each feeding. B. Providing oral hygiene every 4 hours. C. Elevating the head of the bed to 30 degrees. D. Administering antiemetic medication. The answer is C. Elevating the head of the bed to 30 degrees. Elevating the head of the bed to 30 degrees is a priority intervention to prevent aspiration in a client with a nasogastric tube. This position helps minimize the risk of gastric contents refluxing into the respiratory tract. Checking tube placement, providing oral hygiene, and administering antiemetic medication are important but don't directly address the risk of aspiration. Question number 3. Which assessment findings suggest potential digoxin toxicity in a client with a history of heart failure? A. Hypertension. B. Hyperkalemia. C. Visual disturbances. D. Bradycardia. The answer is C. Visual disturbances. Visual disturbances such as blurred or yellow-tinged vision are indicative of potential digoxin toxicity. Hypertension, hyperkalemia, and bradycardia are not typically associated with digoxin toxicity. Question number 4. What is an essential action when preparing to administer a blood transfusion? A. Administering pre-medication for pain. B. Ensuring two nurses check the blood product. C. Using a small gauge needle for infusion. D. Administering the blood product rapidly. The answer is B. Ensuring two nurses check the blood products. Ensuring two nurses check the blood products is an essential action before administering a blood transfusion to prevent errors and ensure patient safety. Administering pre-medication for pain may be necessary in some cases, but it's not an essential action before the transfusion. Using an appropriate sized needle and administering the blood products at the prescribed rate are important, but the two-nurse verification is critical for safety. Question number 5. What's a priority nursing intervention for a client experiencing an acute asthma attack? A. Administering a bronchodilation medication. B. Providing a warm mist humidifier in the room. C. Encouraging the client to lay flat in bed. D. Administering corticosteroids orally. The answer is A. Administering a bronchodilation medication. Administering a bronchodilator medication is the priority nursing intervention for a client experiencing an acute asthma attack. Bronchodilators help open up the airways and relieve bronchospasm. Providing a warm mist humidifiers is not recommended as it can trigger further bronchospasm. Question number 6. During hemodialysis, which nursing action is essential for a client with chronic kidney disease? A. Monitoring blood glucose levels. B. Assessing for signs of infection. C. Restricting fluid intakes. D. Administering iron supplement. The answer is B. Assessing for signs of infection. Close assessment for signs of infection is essential during hemodialysis due to the increased risk associated with vascular access and exposure to blood products. Monitoring blood glucose level is more relevant for clients with diabetes. Restricting fluid intake and administering iron supplement are not specific to hemodialysis. Question number 7. For a client prescribed spironolactone, the nurse should closely monitor for which potential adverse effect: A. Hypokalemia, B. Hyponatremia, C. Hypercalcemia, D. Hyperkalemia. The answer is D. Hyperkalemia. Spironolactone is a potassium-sparing diuretic, can cause hyperkalemia. Close monitoring for signs and symptoms of hyperkalemia, such as muscle weakness and dysrhythmias, is crucial. Hypokalemia, hyponatremia, and hypercalcemia are not typically associated with spironolactone use. Question number 8. The nurse should instruct a client prescribed salmeterol inhaler to use the medication for which purpose? A. Immediate relief of acute asthma symptoms. B. Prevention of exercise-induced bronchospasm. C. Treatment of acute bronchitis. D. Long-term control of chronic asthma. The answer is D. Long-term control of chronic asthma. Salmeterol is a long-acting beta agonist inhaler used for the long-term control and prevention of asthma symptoms. It's not indicated for immediate relief of acute symptoms or treatment of acute bronchitis. Prevention of exercise-induced bronchospasm typically requires a short-acting beta agonist inhaler. Question number 9. Upon noting yellowing of the skin and sclera in a client, the nurse should anticipate which additional finding? A. Dark amber-colored urine. B. Pale conjunctiva. C. Cyanotic lips and nail beds. D. Elevated blood pressure. The answer is A. Dark amber-colored urine. Yellowing of the skin and sclera jaundice suggests liver dysfunction. In liver disorders, bilirubin accumulation can lead to dark amber-colored urine. Pale conjunctiva is indicative of anemia, not directly related to liver dysfunction. Cyanotic lips and nail beds indicates inadequate oxygenation, and elevated blood pressure is not directly associated with jaundice. Question number 10. The nurse should instruct a client with a history of peptic ulcer disease to take omeprazole. A. Before meals. B. With meals. C. After meals. D. On an empty stomach. The answer is D. On an empty stomach. Omeprazole, a proton pump inhibitor, decreases stomach acid production. To maximize its effectiveness, it should be taken on an empty stomach, preferably 30 minutes before meals. Taking the medication before meals allows to act more effectively on acid secretion. Question number 11. A client is receiving heparin therapy for deep venous thrombosis. The nurse should monitor which laboratory value to evaluate the effectiveness of the treatment. A. Activate partial thromboplastin time, APTT. B. Prothrombin time, PT. C. Platelet account. D. Hemoglobin level. The answer is A. Activated partial thromboplastin time, APTT. Heparin therapy is monitored using the PTT, which measures the intrinsic pathway of coagulation. The therapeutic range of PTT varies depending on the client's condition and the prescribed heparin dose. PT is used to monitor warfarin therapy. Platelet count and hemoglobin level are not specific indicators of heparin effectiveness. Question number 12. A client with heart failure is prescribed digoxin. Which assessment finding would indicate a potential digoxin toxicity? A. Bradycardia. B. Hypertension. C. Hyperkalemia. D. Increased urine output. The answer is A. Bradycardia. Digoxin toxicity can manifest with various signs and symptoms, including bradycardia. Other potential findings may include visual disturbances, nausea, and vomiting. Hypertension, hyperkalemia, and increased urine output are not typically associated with digoxin toxicity. Question number 13. The nurse is caring for a client with a traumatic brain injury. Which nursing intervention is essential to prevent increased intracranial pressure (ICP)? A. Elevating the head of the bed to 90 degrees. B. Administering sedatives regularly. C. Encouraging coughing and deep breathing. D. Monitoring and maintaining a quiet, calm environment. The answer is D. Monitoring and maintaining a quiet, calm environment. To prevent increased ICP in a client with a traumatic brain injury, maintaining a quiet and calm environment is essential. Elevating the head of the bed to 30 degrees, administering sedatives, and encouraging coughing and deep breathing are appropriate interventions, but they don't directly address ICP management. Question number 14. The nurse is caring for a client with chronic obstructive pulmonary disease (COPD) experiencing an acute exacerbation. Which intervention is a priority? A. Administering bronchodilators as prescribed. B. Administering supplemental oxygen as needed. C. Promoting rest and conserving energy. D. Providing a high caloric diet. The answer is B. Administering supplemental oxygen as needed. During an acute exacerbation of COPD, maintaining adequate oxygenation is a priority. Administering supplement oxygen as needed help alleviate hypoxia and improve oxygen saturation. Administering bronchodilators, promoting rest, and providing a high-calorie diet are important interventions, but they are not the priority in this situation. Question number 15. A client with diabetes mellitus is scheduled for a diagnostic test with contrast dye. The nurse should prioritize which intervention before the procedure. A. Administering metformin as prescribed. B. Assessing the client's renal function. C. Monitoring the client's blood glucose level. D. Providing education about the test procedure. The answer is B. Assessing the client's renal function. Before a procedure involving contrast dye, assessing the client's renal function is essential to identify any impairment that could increase the risk of contrast-induced nephropathy. Question number 16. A client with diabetes mellitus is prescribed insulin lispro-humalog. Which statement by the client indicates understanding of the medication administration? A. I should mix the insulin with NPH insulin. B. I need to wait 30 minutes before eating after injecting this insulin. C. I should inject this insulin into my thigh. D. I can reuse the same needle for multiple injections. The answer is B. I need to wait 30 minutes before eating after injecting the insulin. Insulin Lispro is a rapid-acting insulin that should be injected 15 to 30 minutes before a meal to allow for proper glucose control. It shouldn't be mixed with other insulins, should be injected into fatty tissues subcutaneously, and require the use of a new needle for each injection. Question number 17. A client is receiving intravenous vancomycin. The nurse should monitor which laboratory value to assess for potential medication toxicity. A. Serum potassium level. B. Blood urea nitrogen BUN. C. Serum creatinine level. D. International Normalized Ratio INR. The answer is C. Serum creatinine level. Vancomycin is primarily excreted through the kidneys, so monitoring the serum creatinine level is essential to assess renal function and detect potential medication toxicity. Serum potassium level is important for assessing electrolyte balance. BUN can indicate kidney function, but is not specifically to vancomycin toxicity. And INR is used to monitor the effects of anticoagulant therapy. Question number 18. A client is prescribed furosemide Lasix for the treatment of hypertension. Which electrolytes imbalance is the nurse most concerned about when administering this medication? A. Hyperkalemia. B. Hyponatremia. C. Hypocalcemia. D. Hypomagnesemia. The answer is B. Hyponatremia. Furosemide is a loop diuretic that promotes the excretion of sodium and water. This can lead to hyponatremia, which is a significant concern. Hyperkalemia, hypocalcemia, and hypomagnesemia are not typically associated with furosemide administration. Question number 19. A client is prescribed warfarin, Coumadin, for the prevention of blood clots. The nurse should instruct the client to avoid consuming large amounts of which food? A. Leafy green vegetables. B. Lean meats. C. Whole grains. D. Citrus fruits. The answer is A. Leafy greens vegetables. Leafy greens vegetables such as spinach and kale are rich in vitamin K, which can interfere with the anticoagulant effects of warfarin. Clients taking warfarin should consume a consistent amount of vitamin K containing food to maintain a stable therapeutic level. Lean meats, whole grains, and citrus fruits don't significantly interfere with warfarin therapy. Question number 20. A client is diagnosed with pneumonia and is prescribed antibiotic therapy. The nurse should monitor for which potential adverse effect of antibiotic treatment? A. Hypoglycemia. B. Nephrotoxicity. C. Hypotension. D. Hypernatremia. The answer is B. Nephrotoxicity. Nephrotoxicity or kidney damage is a potential adverse effect of certain antibiotics. Monitoring renal function, including urine output and laboratory values such as creatinine and BUN, is important.